Hey guys, how are you? My name's Catherine and welcome to my channel. This is going to be my first talk through video and essentially it's going to be a story time about this time last year I had double jaw surgery. Now excuse me if I waffle on for ages because I've never done a talk through, so yeah. But basically this video is just going to be about what happens during the surgery, what to expect during the surgery. Also just if you're interested, like what happens during double jaw surgery. I hope you enjoy the video and if you do, please make sure to give it a thumbs up, subscribe if you want to see more videos like this, and also just leave any comments below if you just have any questions surrounding the surgery or what my experience was and so on. So the process started when I was about 12 years old and I just went for a routine dental checkup. And what I remember from the appointment was that the dentist asked me if I could, leave the room and if he could speak to my mum for a minute. So I just thought, okay, that's a bit weird, but as long as I get my lollipop at the end of the appointment, that's fine with me. So I waited outside, and anyway, so basically I gathered essentially what was said when I was out of the room was that the dentist told my mum that I would need double jaw surgery or surgery to correct my jaw when I was about 18. The reason why at 18 is because that's when your jaw and your bones stop growing. And he was essentially trying to say that I was developing what's called an underbite. An underbite is when your lower jaw is growing at a faster rate than your upper jaw, and so my lower teeth were actually starting to come in front of my upper teeth. Traditionally, your upper teeth should overlap your bottom teeth, so like that. So yeah, basically that was not happening for me. It's quite a common thing actually, but yeah, so if you're just interested to know what an underbite looks like, obviously you can see my before pictures, but yeah, quick Google search and you'll probably recognise it. So yeah, so that's what I was developing. So fast forward, we didn't really give it much thought. I thought I didn't look any different to anyone else. Surgery is a massive no-no in my family, so it was just never mentioned again. So it didn't really bother me, but it wasn't until maybe my late teens, so when I got to about age 17 or 18, it really started to bother me. So firstly, I noticed that I did look different to everyone else. I wasn't drastically I didn't drastically look different, but my face is a lot longer. I definitely never smiled with my teeth because my lower teeth would slightly stick out, and to me I felt very self-conscious of that. And not just that, but I noticed that I would be eating in strange ways. So I'd always eat on my back teeth, never my front. I couldn't just bite into things like an apple or anything, it just was too difficult. Also, I was developing a lot of headaches, and when I was just researching as to why I was getting so many, I sort of gathered that it was linked to the way my jaws were sitting because of the tension that was being brought on by the way that they were sitting. So I was getting tension headaches a lot. So yeah, that was it. I decided that enough was enough. Like, I just wanted to sort this out because I wasn't happy with the way my face was. So yeah, there's two ways to resolve it. You can get braces, but that will only solve the teeth, but your profile, so a longer jaw and everything that comes with an underbite, will remain the same. Or you can get double jaw surgery that will completely solve the problem. Your teeth will be in the right position and your jaws will be fixed into the way that they should be. So I wanted to get double jaw surgery because I didn't like my profile and I just wanted it completely solved. I didn't just want to just cover up the symptoms. I just wanted to resolve it for good. Yeah, at about the age of 21, I believe, I went and took the plunge. I had braces put on, the whole hog. I'd never had braces before as well, so it was super hard for me to get used to them, especially as I work. So I opted for clear braces, which I paid for by myself, and they're called Damon braces. So if braces is what's putting you off getting surgery, I wouldn't let it, because that's what put me off for so many years. But actually, when I put them on, not actually that many people noticed really that I had it, but yeah. So anyway, fast forward all the braces, then we come to the surgery. Now I needed double jaw surgery. Now essentially, double jaw surgery is when they remove your jaws away from your skull, so they actually remove them off. Lovely. And they actually, what I believe, I'm not going to get too scientific or anything, but essentially they just sort of take a piece out when it's removed, and then reposition it back in and position it, fix it in place with some pins and plates under here. So yeah, that's what I was going to go through. And yeah, so also with double jaw surgery, your face will change. So my face, that's what I wanted my face to change. So you, and not just the medical benefits, but you also get some aesthetic benefits from the surgery. So with underbited people, typically this sort of cheek area is quite flat and concave. I didn't like that. Also, my nose, with double jaw surgery, your nose will change. So my nose was, I mean, it wasn't bad really. It was straight, but it was very narrow, which again, I didn't really have a problem with my nose, but that changed since the surgery. My nose actually widened slightly and it's a lot more straighter and tipped up, but yeah, it fits my overall profile. And yeah, and your jaw, just your profile will be more softer than before. Okay, so fast forward to the surgery day. I was shitting myself. You know, I went to the hospital with my parents and we were waiting there. I got into my gown and my socks. I met my surgeon again, went through any last questions, and he told me the surgery would be about 3 to 4 hours, which I was pleasantly surprised at, because for some reason I just thought it was going to be, you know, 6 to 8 hours when I'd googled. That's another thing, don't Google too much, because I was researching it like no tomorrow. I saw these people with faces out here, black eyes, black bruises, and people who were on strict liquid diets for about 6 months. I was tearing my hair out with worry. Like, I'd ordered in so many food supplements, like powdered liquid food, so many protein shakes I ordered. I spent so much on loads of stuff, and really it wasn't that bad, but I'll get onto that when it comes. So back to the surgery day. So I'm in my gown, in my surgery socks and so on. Met the surgeon and the anaesthetist comes in and I meet her. And yeah, it was just a couple of hours of just sitting there. I wasn't actually too bad at that time. I was really, you know, not really thinking that I was going to have this major surgery in the next few hours. And then a few people, I'd say, I think it was 2 people came upstairs with one of those pushy beds, and they said, you know, you're ready now, are you ready? And I was like, and that was when it started to kick in. I was thinking, yeah, help, like I'm actually going down now. So yeah, I got into the bed, and that's another awkward thing. They push you down to the pre-operating room, and like you don't walk, they just push you. So you're just like laying there in the bed. And when I said bye to my mom, I was just like, oh, my dad. Like, I was really trying not to look that nervous, but I could see in their face they were nervous too. So yeah, so was in the pre-surgery room, and that's sort of the room where they administer all the anaesthesia, and it's a really cold room, and I was just laying there. There was about 6 people in there. It was such a blur. They were asking me so many things. They were checking my name, age, date of birth, address, making sure I was who I was. And then I had the anaesthetist woman next to me, you know, playing around with my arms. So I knew what she was going to get up to, you know, putting things in there. So yeah, I was just trying to remain calm, but it was at this point that I was realising there was no going back. I was feeling my face like, oh my gosh, this is the last time I'm feeling this face. Like, when I next wake up, it's going to be out here like a basketball. So yeah, I knew shit was going to go down when the anaesthetist goes to me. Oh, okay, so, you know, making her small talk, she was just like, oh, so what do you do? Where do you work? And I was like, oh, blah, blah. And she was just holding my arm and putting something in it. I didn't know what the hell she was putting in. And then she goes to me, oh, okay, so what's your favourite cocktail? I was just like, girl, like, I'll take anything right now. I just don't care. Like, I just want to get out of here. Like, I'm not in the mood for this. I'm too nervous. And I was just like, my mind went blank. So I was just, okay, like pina colada, anything, anything. And she was like, okay, well, in her calm voice, okay, well, it's going to feel like that, but about 10 of those. And when she said that, I was gone. Like, I didn't even, that was it. Like, if you, any of you have not had an operation before and you're scared about what happens when you go under, I didn't feel anything. I didn't feel like anything, like I didn't feel tired, I didn't feel droop, like, you know, in your eyes, didn't feel anything going into slow motion. I don't even know. I just was out like that, and then I woke up. So yeah, I don't, that from that point onwards, I don't know what happened. It wasn't until, yeah, I woke up just like that. And I just remember the first thing I did was look at the clock over there. And I remember, I don't know if it was about 8 PM, and I think my surgery was at 3 or 4 p.m. So I just remember thinking, oh, like that was quick. And then my eyes sort of came down. I could see my parents over there sort of coming over, and I was like, oh. But it was such a blur. Like, I don't think I said anything. All I remember was doing this. Because when I did this to my face, I felt I had a mask put on. So in the UK, some hospitals give you what's called a hyalotherm mask. It's actually a cooling mask because after double jaw surgery, you're very swollen. Your face continually swells for the first 3 days and grows and grows. So this is sort of to suppress the swelling. So yeah, I had that on, so I couldn't actually feel my face. I just remember just laying there and just, that was all I could do. And yeah, and my parents left. First night I was kept in what's called the ICU ward, and I had a personal nurse. It was actually me only on the ward, which was quite nice. But my gosh, that nurse I had that first night, also the following morning, they deserve medals, literally. Like, I were just amazing. I was a state, like I was an absolute state that night. So the night was a blur, to be honest, because I think you're just pumped full of all the anaesthesia. You're just feeling generally sleepy 1 minute, then I didn't have a full night's sleep. I kept sort of drifting off and then waking up, and then they're also pumping you with an IV, and with that I think you need, because they're pumping so much liquid into you, you need to go toilet a lot. And luckily, you know, I was very lucky and fortunate to have a toilet just in front of me. It's like an ensuite. But I wanted to get up. Obviously you're connected to, you know, that trolley thing that you have to take with you. But because I just wasn't, I don't know, I can't remember because it was such a blur. I couldn't feel able to get myself out of bed. So I'd ring the nurse's buzzer, and as I was coming up, that was it. I was just puking blood. That was all I was puking. Sorry if you're all like, don't like gory stuff, but that was what I was producing. And that's actually a normal thing after double jaw surgery, because all the work that they do is inside your mouth. And during the surgery, obviously, if they're making cuts in your mouth, there's going to be blood, and if you swallow that, your body doesn't want to swallow blood. So naturally, it will reproduce it at its earliest opportunity. So with the IV getting pumped and pumped, I needed to go toilet a lot that night. Every time I would get up, I'd get the bowl, puke up blood, that's it, and then go in and go toilet, come back, and that was sort of the routine during the night. So yeah, it wasn't, you know, a pleasant night, but yeah, we got through it, and I'm thankful to the nurse that looked after me that night because she was very helpful. Okay, the first thing that worried me when I started to feel a bit normal was, oh my gosh, what do I look like? And it was that scary moment of when I went into the bathroom and I knew the mirror was there, and I just thought, do I want to look in it? Like, I'm scared. After Googling it so much, I thought I'd have black eyes, you know, my face, would it be out here? Because I felt it, and I don't know, my face was numb. I could not feel my face. Everything was like I could do this and I couldn't feel it, and I couldn't open my mouth. I couldn't open it. I wasn't wired shut, fortunately. So in the UK, I don't think they wire you shut, but I couldn't open it. Like, I'll tell you the severity of how little I could open it was the following morning. The nurse brought me a milkshake. It was sort of a thickish milkshake. It was like a yogurt consistency with a teaspoon, like a small baby teaspoon, and she said, you know, this is your breakfast and so on. The level I could not open my mouth was I could not even get the tip of the teaspoon in between my teeth, because I don't know, it's because my face was so numb, I could not lift it. So yeah, I couldn't have breakfast, but I wasn't that hungry. So anyway, if we reverse back to looking at myself for the first time, I was really worried, I'm not gonna lie. And yeah, I crept into the bathroom and I saw the mirror, I looked, and I wasn't even that shocked. Okay, I was swollen, but I did not look like what I thought I was gonna look like, and I was really, you know, relieved at that. But I did know that day 1, you're gonna be swollen, but your swelling grows from day 2 to 3, and after that, it will start to come down gradually. So I knew it was gonna get bigger. but I just was relieved that I got through the surgery and it wasn't that bad to begin with. So after that first night in the ICU ward, my surgeon came in and saw me and said that I probably would only need one more night just to be monitored, and just one more night in a normal room. So I was moved into my own private room, which was really good. But it was boring. It was so boring. My parents came to see me, and that was fine, but they only had the TV. It's just like shitty daytime TV. Like, I didn't bring anything because I didn't think I'd be up to it. But actually, you know, if you are going to go through this, I would bring something. Okay, I did use my phone and stuff, but you know, like a book or anything, like an iPad, I definitely think you'd be able to use it, because I was bored like the whole day just sitting there watching crappy daytime TV, and there's only so much Snapchat and Instagram you can go on, you know, when you're feeling a bit ugh. So yeah, I was bored. But yeah, just to give you an idea, I still couldn't really open my mouth, but by day 2 I was able to have some thin tomato soup with a tablespoon, but it took me ages. Another thing was the medication. Because you can't open your mouth, they give you liquid medication in a syringe, because you'd fit the sort of syringe in any gap that you had, that you could open your mouth and just put it. That's what I hated. That was one of the worst things about the surgery. The taste of liquid ibuprofen and the liquid antibiotics was vile. Like, I don't know if it's just me and my taste buds, but I literally had to like rev myself up to, it was like taking a shot, but I was making it bad for myself because I just give myself like a little bit, and then so that was a negative. So yeah, day 2 I was sort of looking forward, because I was going to go home the next day, so I was sort of looking forward just to getting back into my own bed, you know, being in my own space and all of that. So yeah, day 3 came along. That day was tough for me. That was probably the toughest day, because when the swelling is growing, you feel very uncomfortable. Your face feels so tight and greasy. That's all I can describe it as, tight and greasy. I had no pain whatsoever, but the uncomfortableness was hard. It was hard to deal with. But not only that, was day 3 was not just hard because of that, but I couldn't breathe properly. I think this is specific to my case, but I couldn't breathe. My nose was very blocked, and this is also quite, the nose blocking is typical of jaw surgery. Because of everything they do in your mouth, your nose can get blocked with blood, and quite congested. So yeah, my nose was very blocked. So basically it's hard because you can't really open your mouth and your nose is blocked, so it's kind of difficult to breathe anyway. But I think in my case, I don't know what happened, but I genuinely just it was like I was doing that, and it just felt like my chest was so congested with something, like very hoarse, and it was very worrying for me. And it got so bad that I rang my nurse's buzzer, and I wanted to tell her I couldn't breathe properly, but every time I spoke, I couldn't speak, so I literally typed it on my phone, I can't breathe properly. And the nurse goes, oh, you know, your nose is blocked, it's normal, don't worry. So I thought, okay, fine, but I was really struggling to breathe. So she went away, and I had wipes on my table, so I was trying to sort of wipe my nose and sort of clear it up a bit. But my throat was so hoarse and difficult, and it was just getting worse, to the point I actually started crying. I was panicking. So I rang the buzzer again and I typed it out, I can't breathe. And then to that point she brought the doctor in, and the doctor just proceeded to sort of look at me whilst I was crying, because I think he was trying to work out, like, am I just in a state of shock from my anesthesia, or, you know, is she just panicking? But I genuinely couldn't breathe. Like, I don't know how to describe it, but I just couldn't breathe. My parents actually turned up because they thought they were taking me home, and they saw this doctor in there, and they saw me crying, like sitting on the edge of the bed, like that's literally what I was doing. It's funny now, but at the time it was not funny for me. So yeah, and then they brought me is it a nebulizer, the thing that you put over your mouth to breathe in, and it just didn't help me at all. So to that point the doctor said that I should have a chest x-ray just to check if I had anything in my chest. Had a chest x-ray that was completely fine, and nothing came up, and still I couldn't breathe. And I said to my mum, it feels like something's in my chest. Just feels like I need to cough, but I'm scared to cough. I was scared to cough because, one, I didn't want to be sick. Two, if I coughed, I was scared that I was going to choke or something on my cough, if that makes sense. But my mum encouraged me. She was like, just cough, cough. So I was like, okay. And I coughed. And that was it. It was fine. It was absolutely fine. It was, I don't know what it is. I still don't know what it was. I don't know if it was just where they had done so much work inside my mouth, if stuff had gone down and it was clogging up my throat. But once I coughed, I felt back to normal. Thank the Lord. So yeah, after that horrible day of day 3, I could go home. In the car on the way home from the hospital, I'm just feeling genuinely crap. Like, I just want to get home. Day 3 is, you know, those first few days are a bit rough after the surgery. You're not feeling yourself after all the anesthesia. You feel tired and very uncomfortable. Again, I had no pain whatsoever, but the level of uncomfortableness is probably, you know, 8 to 9 out of 10. So on the motorway on the way home from the hospital, and I think I nodded off, because all I remember is just waking up and the car was just moving to the left, to the what's that, you know, that bit on the left of the motorway where, you know, cars break down and stuff like that. Yeah, we were breaking down. We were breaking down the day that I wanted to get home after my major traumatic surgery. So yeah, our car broke down on the motorway on this day of all days. And we were still about a good 2 hours from home, because I had to have my surgery in a hospital that was quite far from me. And yeah, and we didn't know where we were. So when my parents were trying to ring up the recovery service, they were trying to pinpoint where actually we were, because the signal was not that great, so we couldn't really look up. And yeah, so we proceeded to wait 2 hours on the side of the motorway. Me with a big swollen fat face in the back, just crying again because I just wanted to get home. So yeah, make sure that your car is in working order when you're returning home from your jaw surgery, so you can get home to your bed as soon as possible. Yeah, let's just fast forward now to my time spent at home. So I spent 3 weeks off work. This was just because this is what was recommended to me by my surgeon, but also because the first weeks you need to have liquid only food or soft food. I was very fortunate because my parents are good cooks and very good carers, so I actually was on a lot of soft food. So what I suggest, I mean, you have to speak to your surgeon on what they suggest for you, but I was only given 2 elastics to wear on my teeth. I was not wired shut, just 2 elastics like that. And my surgeon said to me I could remove these, eat, then once I'd eaten and brushed my teeth, put those back on again, just to keep the jaw in place whilst it heals. So I was very fortunate. So yeah, I generally, after the first week, I'd say, generally was having most normal dinners just blended. Now that sounds really rank, but when you're hungry you don't really care. So yeah, some of the food I had was liquid, well, blended ravioli, blended you know, porridge, mashed potato with cream cheese. It's actually quite an okay diet, because I had a lot of milkshakes that I made with bananas and Nutella. So yeah, it's not that bad in terms of food. I'd encourage you just to sort of look for food that you would generally eat and just blend it as much as possible. So if you just want to make things more liquidy, add milk or water or cream cheese and things like that, or cream, so on, just high calories, so you get your calories in, you don't lose a lot of weight. I didn't lose that much weight as well. I know I was very scared because I didn't want to lose weight, and in total I only lost 3 pounds, which is really good, because I'd read, you know, people losing 2 stone, a stone, and I didn't want to. I mean, you could certainly, if you wanted to lose weight, this would be a good time to try, because you could sort of work out how much meals you wanted in the day. But for me, I was able to retain my weight. And yeah, so those 3 weeks off work were very difficult for me, because okay, at first it was nice, because it was nice just to be at home for once, but I couldn't sleep. I think where I wasn't active because I didn't want to leave the house where I was swollen, I couldn't sleep, so I'd be tired in the day, and then it'd get to, you know, 11 o'clock and I'd get into bed, my head would hit the pillow and I'd be wide awake. I'd be wide awake all night till about 4 o'clock, and I'd get about 2 hours sleep. So it was difficult in that respect, and I couldn't go out, so it was hard to be at home and bored because there's only so many box sets you can watch. But yeah, it's just a good time to sort of focus on things like if you want to organise stuff at home, if you want to get into some books or a box set, or, you know, make a website or a blog about your surgery. It's definitely a good time to do that and to focus your energy on. So yeah, going back to my face, I was completely numb. So again, just to reiterate, I had no pain during the procedure or during after the procedure, no pain whatsoever. I don't know if that's because I was on my medication a lot, but definitely when I returned home I didn't use my painkillers. I used them the first couple of days when I returned home, but actually after about day 4 I never actually used painkillers because I didn't have pain, which is great. So yeah, I had a numb face. This left nostril was completely numb. Like, I don't know if you've had numb things before, but it's such a strange sensation just sort of touching it and not feeling anything. All under here was very numb, couldn't feel anything, but that was partly to do with swelling. I started to get some bruising here, some yellow bruising, but again, nothing too bad. And my lips were numb as well. So yeah, a lot of people are put off by the numb situation, and my surgeon told me that within 6 months, about 80% of your swelling, I think, anyway, roughly these lines, it's not correct really, but in 6 months time, you know, all your swelling should go. And then a year, any residual swelling should definitely go. Also with numbness, it's very rare to have complete numbness, and there might always be some areas that can be permanently numb. I don't know at what point my numbness subsided, but definitely I know when I returned to work I was still numb here, and my nostril and this part of my lip was completely numb. But and also I was still swollen here as well, but not too bad. So my swelling, I would say, completely went, I don't know, I'd say 3 months it took for everything to go down, but 3 weeks later after the surgery I looked normal. Like, I could go out and no one probably would think, what's happened to her. Actually, when I returned to work 3 weeks later, I hadn't told many people what I was having done because I was very embarrassed. Actually, this is sort of, it's only recently I've become very proud to talk about it. I was actually embarrassed to tell people that I was having jaw surgery. So when I returned, obviously my close friends at work knew, but the wider sort of office area didn't know that I had it, and I could notice some people looking at me a bit differently. They were like, you know, But yeah, so I heard from other people that people had been asking, had I had a nose job, or had I had, you know, my cheeks done, or no one could sort of pinpoint what had changed about me. So yeah, obviously I told people that I had jaw surgery and it all came out, and it was no big deal. Just people were intrigued to know, you know, what happened during it, and wow, you know, that's a drastic thing. What I could best describe myself at 3 weeks looking like was normal, but the swelling makes it look like you've had a lot of fillers or Botox or things. You look like very plumped up. That's probably what I could best describe it as. But again, all of that sort of swelling subsides over the following months to the point that you don't really notice you're changing ever so slightly. So fast forward to a year, all my numbness has gone. The only area that's numb is my gums, completely numb. It's so weird, like I can tap it and I don't feel anything, but it doesn't bother me at all. Like, I don't actually notice it numb, it's only if I physically touch it. So again, I wouldn't be put off by any numbness. Generally, you'll get all your feeling back. And one way to tell if you are getting it back is you start to get pins and needles, which is quite uncomfortable, but you get pins and needles and this is your nerves sort of coming back into action. Super glad that I went and had the surgery done because I feel a lot more confident. I'm really annoyed that I put it off for so many years. Like, if you can get it done and you want it done, then definitely go and have it done. You know, the recovery is not amazing, it's not fun, but again, it's not the worst thing. I've been through worse things in life. And yeah, it wasn't that bad, especially if you're very prepared and you know what to expect. And I hope videos like this can help you. So yeah, I'm so glad I've had it done. Now I can smile without being embarrassed. Now I can eat whatever I want. Now I'm a lot more of a smiley person. Yeah, people used to think like I had quite a generally moody face, but I don't know, the surgery is sort of, I smile more now. Now I'm getting wrinkles here because I smile too much, because I like showing my teeth off. And not just that, but I get a lot less headaches now than I was having before. Yeah, again, I can eat whatever I want. I would get very nervous if people could see me from the side because of my profile, but now I don't mind. Now I prefer my profile to my actual front view of the face. So yeah, definitely get it done if the surgery is something that has been suggested to you and you believe it will benefit you. And yeah, so please let me know if you've got any questions whatsoever relating to the surgery, and also just if you want to ask me anything about my experience and so on, please just let me know down below. And yeah, hope you enjoyed the video, and please make sure to like and subscribe.